Okay, so in this video, we'll take a look at the important questions which are given in USMLE Step 2. So our question for today is college-aged man means that he is about 18 to 20 years of age, passes out without any inciting factors and has no prodromal symptoms or signs of seizure. After recovering, his cardiac exam is unremarkable and an ECG shows a slurred upstroke of QRS. Now, the keyword here is slurred upstroke of the QRS. Now, we should be able to identify ECGs which are characteristic of for different clinical presentations. For example, in case of Wolff-Parkinson-White syndrome, we get a slurred upstroke of the QRS complex of the ECG. So this is a classical picture of WPW syndrome. Now, what will be the treatment options or the next best steps? Let's take a look at that. So the answer to this question would be that this is WPW syndrome, and the next step, we know that in case of WPW syndrome, what really happens is that there is an accessory pathway for the conduction of impulses from atria to ventricles, and due to which there is a recurrent excitation of the ventricles, and which is independent of the normal pathway, right? So for that, we will basically prescribe the patient with antiarrhythmic drugs like procainamide, right? And in addition to that, we'll do the ECG exam, and if the patient is also presenting with syncope, like in this case he passed out or he had a syncope, that will also raise a suspicion of atrial fibrillation, and for that we will make sure that we do not give an AV node blocker. Okay, so AV node blockers are contraindicated in case of WPW syndrome. So adenosine, beta blockers, or calcium channel blockers are not indicated in case of WPW syndrome. Only antiarrhythmic drugs are given, and if that doesn't work, then we can do the catheter ablation of the accessory pathway, but we never give AV node blockers. For example, beta blockers, adenosine, calcium channel blockers are contraindicated, and what we can give is we can give procainamide, which is the antiarrhythmic drug. So this is the answer to the above question, right? And I hope it was helpful for you, and we will keep on revising such topics, and best of luck.